Welcome to JAT Chat, presented by the Journal of Athletic Training, the official journal of the National Athletic Trainers Association. I'm Dr. Kara Radzak, an associate professor at the School of Integrated Health Sciences at the University of Nevada, Las Vegas, and your host for today. Today, I am joined by Dr. Francesca Genovese, the lead author of the recently published original research article, The Relationship Between Active Coping Skills and Self-Reported Knee Function in Individuals with Anterior Cruciate Ligament Reconstruction in the Journal of Athletic Training. Dr. Genovese is an assistant professor specializing in rehabilitation science within the Division of Kinesiology and Health at the University of Wyoming. Her research interests involve investigating the impact of biopsychosocial factors on health outcomes among individuals with sports-related injuries, such as anterior cruciate ligament reconstruction, as well as exploring the use of immersive technologies and serious games to evaluate and improve outcomes after injury. Thank you so much for joining me today.
Yeah, thank you for having me. I'm happy to be here.
Now, Frankie, before we dive into the topic that we're going to be talking about today, your recent publication, you have to tell me, what are serious games?
Okay, that's a fantastic question. Serious games are games that serve any other purpose aside from enjoyment. So, games that maybe also target improvements in physical activity. If you think about Wii Sports and when that came out many years ago, they're fun and enjoyable. However, they also have this other component. And so, those can be health related components or educational components. And so while I was doing my PhD at Michigan State, I actually had the opportunity to get a graduate certificate in serious game design and research. And so that is something that I am also very interested when it comes to this area of work, and specifically immersive virtual reality exergaming or exercise-based gaming.
That's so cool. Well, I look forward to seeing that part of your work in the
Yeah,
future.
thanks.
And today we're going to really talk about that biopsychosocial aspect some, right?
Yes.
So, can you provide an overview of kind of what inspired you to look at this active coping skills relationship with ACLR?
Absolutely. Yeah. So this study, like you kind of mentioned just from the title, looked at the relationship between active coping skills and self-reported knee function in this ACL reconstruction population. And I led this study with a fantastic former MSAT student at Michigan State, Autumn Bennett. And we were kind of talking about what may be really important for individuals with ACL reconstruction as they're going through that rehabilitation and return to sport process. Most of the work that our lab was doing there focused on individuals with ACL reconstruction. And so we see that a lot of this patient population experiences deficits in self-reported knee function, and that is throughout the rehabilitation process, even at return to sport and after return to sport. And a lot of work has started to explore psychological factors that may be influencing some of these physical outcomes, especially in this population that has such a high risk of secondary ACL injury. However, coping and how this population kind of manages perceived stressors has been less explored. But when you look at things like the integrated model of response to sport injury, that kind of proposes that behavioral and emotional responses, which also include coping, kind of contribute to psychosocial recovery outcomes and physical recovery outcomes. So we decided that we wanted to explore some of these coping related facets and skills in this population to see if these are connected to some of those physical recovery outcomes.
Can you give us a little bit of background on what are the different forms of coping? Because you mentioned two.
Yep, absolutely. So when we think about coping, and I think it kind of helps to take one step back. So coping is essentially how an individual manages perceived stressors to try to reduce that stress. And so you kind of have two primary forms of coping. You have passive coping, which is characterized by the use of what are called emotion focused coping strategies. And these kind of target the emotional responses from that stressor. And so emotion focused coping strategies tend to include things like avoidance, of the stressor or withdrawal from an environment causing that stressor, or kind of trying to minimize those emotional responses to that stressor. And then you have active coping, and that is characterized by what we call problem focused coping strategies. And so, with problem focused coping strategies, instead of trying to manage the emotions associated with that stressor, they're trying to directly manage the stressor itself. So these are cognitive and behavioral strategies that can include kind of trying to generate some kind of solution to solve that stressor, setting goals to kind of overcome that stressor, or just kind of taking action to solve that problem. So this can include things like goal setting or relaxation strategies, mindfulness, things of that nature.
So, give us some information about your basic methodology and how does one quantify active coping?
Yeah, that's a fantastic question. So there are a handful of different ways that you can quantify coping skills and coping strategies. For this study, we used what's called the Athlete Coping Skills Inventory, and that is a 28-item questionnaire that specifically looks at different coping strategies employed by athletes. There are a lot of other general coping related measures that can be used in clinical practice, but for this study, we also took that athlete coping skills inventory, and we were primarily interested in looking at what we considered active coping skill facets from that questionnaire. So the questionnaire specifically looks at, I believe it's 7 different subscales. And so it includes peaking under pressure, coachability, concentration, freedom from worry, confidence and achievement motivation, goal setting and mental preparation, and then coping with adversity. And so we decided to specifically look at the 3 subscales of confidence and achievement motivation, goal setting and mental preparation, and coping with adversity, because we were kind of trying to identify variables that are representative of coping skills that may influence clinical outcomes after injury. So things like motivation, which could be linked to that confidence and achievement motivation, or resiliency, which is kind of targeted with that coping with adversity subscale, and then also adherence to rehabilitation, which could be linked to that goal setting and mental preparation subscale. So we specifically focused on 3 of the subscales from this athlete coping skill inventory to get a better idea of how these individuals may self-report these active coping skill facets.
Tell us about the individuals that you
Mhm.
evaluated.
Yeah, so for this study, we had 45 individuals with ACL reconstruction. And so they were predominantly female. I believe we had about 34 females in our sample, which in ACL research is pretty common, but they were a pretty wide time frame from surgery. So we had individuals who were between 4 months and 5 years post-surgery. So it was a pretty mixed demographic of individuals who were still actively completing rehabilitation, individuals who were at that time of return to sport, and individuals who had already returned to sport. I think the median time since surgery was about 12 months, and it was somewhat of a younger demographic, being about 20 years old. But we did control for age and time since surgery in our analysis just because of that wide variability in those demographics and the potential influence of things like age and time since surgery on these outcomes.
And then how were you guys measuring their knee function?
Yep. So for knee function, we use the knee injury and osteoarthritis outcome score. So that is a questionnaire that essentially looks at knee related function across 5 areas: pain, symptoms, activities of daily living, quality of life, and sport and recreation. And so we administered that questionnaire to get an idea of their subjective knee function, and then ran a partial Spearman correlation controlling for age and time since ACL reconstruction to better understand how those ACSI subscales and those COOS subscales were correlated.
Now, which subscales did you find to be significantly correlated?
Yeah, so for this, we found some moderate positive correlations between the ACSI subscales and some of the Q subscales that were statistically significant. We saw some weak positive correlations as well, but the big ones that we saw that were moderate were between the ACSI confidence and achievement motivation subscale and then knee related pain. So the KOOS pain subscale, knee related quality of life, and then knee related function in sport and recreation. We also saw a moderate positive correlation between the ACSI goal setting and mental preparation subscale and the KOOS pain subscale. So the KOOS pain was moderately correlated with two of those ACSI subscales, but the ACSI ones that really stuck out were that confidence and achievement motivation and then the goal setting and mental preparation.
How do you feel like athletic trainers and other clinicians could best implement these findings into their real world clinical practice?
Yeah, I think that's a fantastic question. And I think with this area of work that I'm in now, looking at psychological outcomes and especially using things like patient reported outcome measures, one of the best ways to take some of what we're seeing in the literature and from studies like this is by implementing some of those patient reported outcome measures in clinical practice. And athletic trainers tend to do a very good job of that with physical outcome measures, but I think also emphasizing the use of psychological patient reported outcome measures is also important. And that kind of starts to get into the area of what we call psychologically informed practice, which is where we do our traditional musculoskeletal rehabilitation, but we also then start to kind of incorporate patient beliefs, values, and attitudes and take those into consideration and some of those psychological factors to really provide whole person care. And so instead of just focusing on those physical outcomes, we take into account some of those psychological factors as well. And so I think from a study like this, kind of taking away the importance of also considering some of those psychological factors. Because when we have patients who are completing rehabilitation processes and maybe they're not progressing the way you anticipated, or maybe they have regressed in some area, or they're having changes in physical outcomes and you're not sure what's contributing to that, it could be very likely that it is some aspect of their psychological response to injury that may be also influencing some of those outcomes. And so I think starting by assessing those kind of responses with patient reported outcome measures can be really helpful to get a better understanding of other things that may be contributing to patient recovery.
As clinicians, we're so used to like measuring the numbers, right? Like we can see the goniometer changing, we can see their strength. How could we use something like this athlete coping skills inventory to give us that ability to get like tactile information on those squishy biopsychosocial things that, although we know are incredibly important, are hard to pin down?
Yeah, that's a great question. And I love that you kind of went into that saying that we love seeing the numbers. And patient reported outcome measures essentially give you that exact same thing because we can get a very good idea of how our patients are recovering and how they're feeling by just conversing with them. And that's really important too, to have those conversations and discussions with patients. But when we also implement these PROs, that is giving us a number as well, because these patient reported outcome measures have a score associated with them that give you an idea of my patient is scoring very high in coping skills or very low in coping skills. And that may then help you further understand maybe we need to implement more goal setting in our rehabilitation approach because this individual is scoring very low on that goal setting and mental preparation subscale of this outcome measure. And so that is another important thing to consider with patient reported outcome measures is using them, but then also understanding what does that score mean? And then how can I use that score to help my treatment approach? Is that going to help guide maybe what treatments or interventions I want to use? If I continue to use that, then I can look at changes over time. Are we seeing improvements in these outcomes? If not, maybe that tells me I need to start implementing something else in my treatment approach. And so I think with the athlete coping skills inventory or some other coping related inventories, there are much broader ones. There are kind of pain coping questionnaires if you have patients who are really struggling with pain associated with injury, or broader coping kind of questionnaires that have up to 60 questions on them that just generally ask about active and passive coping. And so I think part of it is identifying what do I want to know in regard to my patient's coping skills, and then how can I take that and use that to kind of assist with the treatment that I'm providing.
60 sounds like a lot. That 28 number's a lot.
Well, I know, and that's one of the great things about patient-reported outcome measures. So many of them have adapted to having, like, brief versions, and so that 60 item, it's called the coping questionnaire to problems and experiences scale, I think. It started as a 60-item measure, but that has now been abbreviated to a 28-item measure as well. So, with a lot of these, because I understand that time and workload pressure can influence our clinical practice, they do have shorter measures that can be easier to score, easier to interpret.
That's great. So you were looking specifically at this ACLR population, but how do you feel like your findings or just this approach could be transferred to other populations?
I think we're starting to see a lot of similar responses with some of these psychological variables across a variety of musculoskeletal injury populations now. And I think we're starting to see similar research in a chronic ankle instability population, femoral acetabular impingement syndrome. And so I think now that we're really expanding into this area, we are starting to see these psychological factors contribute to physical recovery from these other musculoskeletal injuries as well. And even we've seen in other sport related knee injury populations kind of the role of active coping skills on things like motivation and adherence to rehabilitation and even transition to life outside of sport. And so I think from a coping skill perspective, these are really important psychological factors and skills no matter what the injury is. But I think also, especially in these populations that have a really long rehabilitation process where these individuals are removed from sport and they may be removed from their social support system if that is their team. How are they coping with that? And how is that kind of influencing other areas of their life? So I think a lot of this could be translated to other musculoskeletal populations, especially with that long rehabilitation process where that return to sport is a much farther time point.
Can you give us some, like, I don't want to say easy, but initial entry ways that a clinician could get into helping their athletes build these active coping skills?
Absolutely. And it's probably not as challenging as you think because some of it is skills that we are able to implement as athletic trainers. Big one is education, which is a huge part of our job. And we're doing a lot of that already. But research has shown that individuals with sport related knee injuries essentially seek to engage active coping strategies. They want to play a role in their recovery. And so, one kind of early step at the beginning of that injury rehabilitation process can be educating our patients on what that injury entails, what that rehabilitation process entails, what that surgery entails, so that they have a better understanding of how they can manage potential stress associated with that process. Goal setting is another large one that a lot of times we already use in clinical practice, which is fantastic because that's a skill that a lot of athletic trainers have. But making sure that we're implementing that goal setting process throughout the rehabilitation process for whatever injury it may be can be very helpful. And also making sure that we're involving patients in that process and we're building our goals and not just focusing on a larger outcome goal. But we can also use some kind of relaxation techniques, things like breathing or mindfulness meditation. Those kinds of techniques can help reduce some of the physiological symptoms associated with stress. That can also target some of the emotional responses associated with that stressor. And so, implementing those into rehabilitation programs or teaching athletes those skills, how to engage in certain breathing techniques, box breathing, where you're inhaling for 4, exhaling for 4, holding, those kinds of things, and kind of assisting them with developing those skills can be really beneficial. And we've also seen that some of those kinds of strategies also improve physical recovery outcomes. So it's kind of best of both worlds where you can assist an athlete in developing some of those active coping skills, and those may actually also improve some physical recovery outcomes throughout that rehabilitation process.
So, as you move forward, what are some big unanswered questions or areas that you really want to see this research grow?
That's a great question. And I think one of the big limitations is that our patient population was a really wide range from that surgical time point. And I think what would be really great to see and kind of pursue next is a population that is actively undergoing that rehabilitation process and getting a better idea of are they employing these coping skills during this process? And is that having any influence on physical recovery outcomes? Or some kind of intervention study where we are actively, implementing active coping strategies or those problem focused coping strategies and seeing if those have an effect on some of those outcomes. I think there's also some other really interesting demographic factors that could influence coping skills. There are differences between males and females tend to focus more on emotions that are associated with stressors. There are differences between adolescents and adults. And so I think this is kind of just the tip of the iceberg in better understanding coping skills in this population and their relationship to some other outcomes like self-reported knee function. But I think there are a lot of other really interesting and innovative ways that we could continue looking at some of these outcomes too.
As we wrap out, if the individuals that are reading this article or listening to this could take away one thing from your paper, what would you really want to get communicated?
I touched on this a little bit, and I think even more broadly from this paper, but just with my experiences in this area, it's the understanding of the link between psychological and physical factors in recovery processes after musculoskeletal injury. And that's that whole biopsychosocial factor and how biological factors are connected to social factors and are connected to psychological factors. And all of these interplay with one another. And so I think just really emphasizing the importance of considering some of those psychological factors throughout the recovery process and assessing them, whether it be through patient reported outcome measures or conversation with patients, but making sure that we are providing that psychologically informed care to really help treat that individual as a whole and not just their injury.
As you're building up, I mean, you recently got to the University of Wyoming, and as you're building up your research out there, what are some things that you guys are doing, and what are some things that you're really excited about?
Yeah. Thank you for that question. Actually, interestingly enough, and kind of related to this coping piece, we're starting to pursue a little bit of research looking at coping and how coping may change throughout the rehabilitation process, as well as some psychological and physiological stress related outcomes. So I'm really excited to take a little bit of a deeper dive into that area and look at some of those things in this population in that active recovery process.
Perfect. Well, Dr. Frankie Genovese, thank you again so much for joining us. And everybody listening, this is available free, open access, like all of the Journal of Athletic Training's resources. And I hope everybody out there goes and takes a look. Thank you again.
Thank you.